Ever pondered about what happens when your body hits a roadblock in its digestive highway? We're talking about bowel obstruction today. Imagine cruising smoothly along your body's internal highway, the digestive tract, when suddenly there's a detour, a blockage, an unseen obstacle. This is bowel obstruction, a medical condition that halts the journey of food and fluids through your digestive tract. It's more than a mere hiccup in your body's system. It's a serious condition that can lead to severe complications if left untreated. It's like a ticking time bomb, ready to explode with a host of health problems. From severe abdominal pain, bloating and vomiting to more serious consequences like tissue death and sepsis, bowel obstruction is a silent but significant enemy. The key to tackling this unseen nemesis lies in early detection and prompt treatment. So, wouldn't you want to know how medical professionals detect this unseen obstacle? The first step in diagnosing bowel obstruction might surprise you. It involves a chat. Yes, a chat. But not the casual coffee catch-up type. We're talking about a detailed conversation with the patient about their symptoms and medical history. So, why is this chat so crucial, you ask? Well, when it comes to bowel obstruction, the symptoms can often tell us a great deal about what's happening inside the body. Let's delve into some of the most common symptoms. First up, abdominal pain. This isn't your average stomachache, it's a severe, cramp-like discomfort that comes and goes. It's like your body is trying to tell you, hey, something's wrong here. Next, vomiting. It's not just a sign of a bad sushi experience, it can also indicate a blockage in the bowels. The body is trying to rid itself of whatever it can't pass through the digestive tract, so it resorts to the only exit it can find, the mouth. Then we have constipation, a symptom that's often overlooked. If you're unable to pass stool, it could be a sign that something is blocking the way. Similarly, the inability to pass gas is another telltale sign. It's like a traffic jam inside your intestines. Nothing can get through. But it's not just about the symptoms. A patient's medical history can also provide invaluable clues. Have they had abdominal or pelvic surgery in the past? This could lead to scar tissue formation, a common cause of bowel obstruction. Or perhaps they have a history of cancer, inflammatory bowel disease, or diverticulitis. All these conditions could potentially lead to a blockage. These conversations are like piecing together a puzzle. Each symptom, each bit of medical history, provides a clue, bringing us closer to the diagnosis. But let's be clear, these are just clues. They point us in the right direction, but to be certain of the diagnosis, we need more than words. We need concrete evidence. But conversations only provide clues. To confirm, we need concrete evidence. Once the conversation clues point towards bowel obstruction, it's time for the hands-on approach, a physical examination. The physical examination process is an essential part of the diagnostic journey. It's a simple three-step routine. Look, feel, and listen. Each action aids in detecting signs of bowel obstruction and helps to construct a clearer picture of what's going on inside the body. Let's start with the look step. Here, the doctor observes the patient's overall appearance and demeanor. Are they in pain? Is their abdomen distended or bloated? A patient with bowel obstruction might show visible discomfort or exhibit signs of abdominal swelling. Next, we feel. This part of the examination involves palpating the abdomen. It's a gentle process, carefully pressing on the abdomen to identify areas of tenderness, distension, or possible masses. This tactile exploration can reveal telltale signs of obstruction, such as localized pain or abnormal hardness. Lastly, we listen. This involves auscultation, where the doctor uses a stethoscope to listen to the sounds of the abdomen. In a healthy individual, the abdomen presents a symphony of gurgles and rumbles. But in the case of bowel obstruction, these sounds might be high-pitched, muted, or even absent altogether. The power of the physical examination lies in its ability to provide immediate, tangible insights. It's a hands-on method that allows the doctor to interact directly with the patient's body, identifying signs and symptoms that might not be apparent from a conversation alone. However, it's important to remember that physical examinations are just one piece of the diagnostic puzzle. They offer crucial insights, yes. They can indicate the presence of an obstruction and even hint at its location. But to truly understand the severity and nature of the obstruction, we need to delve deeper. Physical examinations provide a valuable surface-level analysis. They lay the groundwork for further, more detailed investigations. These investigations help to confirm the diagnosis, identify the cause, and guide the treatment plan. Physical examinations offer crucial insights, but to see the complete picture, we need to look within. When words and physical signs suggest bowel obstruction, it's time to bring in the big guns, imaging techniques. These are not just fancy pieces of technology. They are crucial tools that help us see what's going on inside the body. Firstly, let's discuss X-rays. X-rays are like the superheroes of imaging. They can see through your body. The X-ray machine sends a quick burst of radiation through your body to produce images of your internal structures. In the case of bowel obstruction, X-rays can reveal signs such as multiple air fluid levels or a stepladder pattern that strongly suggest the presence of an obstruction. Moving on, we have the CT scan or computed tomography scan. This is a more advanced imaging technique that uses a series of X-ray images taken from different angles to create cross-sectional images, or slices, of the body. These slices can be combined to produce a detailed 3D image, providing a clear picture of any obstruction, its size, and its exact location. CT scans are more sensitive and specific than X-rays, making them an excellent tool for diagnosing bowel obstruction. Last but certainly not least, we have ultrasounds. Unlike X-rays and CT scans, ultrasounds use sound waves to create images. They are often used when the patient is a child, or when radiation exposure needs to be minimized. Ultrasounds can help identify the cause of the obstruction, such as a tumor or hernia, and can also show if the bowel is dilated or if there's fluid in the abdomen. Each of these imaging techniques has its own strengths and weaknesses, and the choice of which to use often depends on the patient's specific situation and the resources available. But regardless of which one is used, the goal is the same: to obtain a clear and accurate picture of what's going on inside the body. This information is crucial in planning the next steps in management. With the obstruction in clear view, the next step is to plan the approach for removal. And that, my friends, is where we'll pick up in our next scene. After collecting all the evidence, the final step is to form a treatment plan. It's like solving a complex puzzle where the pieces represent symptoms, physical examination findings, and imaging results. Once we've pieced together this puzzle, we can see the full picture of the bowel obstruction, and it's time to strategize. Treatment options for bowel obstruction are wide-ranging, and they fall into two main categories: non-surgical and surgical. Let's take a walk down the non-surgical route first. This path is often chosen when the obstruction is partial or caused by a functional issue, meaning the bowel isn't physically blocked, but it's not working correctly. Non-surgical treatment often includes a wait-and-see approach, where doctors monitor the patient closely while providing fluids and electrolytes to prevent dehydration. Medications to alleviate symptoms and improve bowel function may also be used. However, when the obstruction is complete or caused by something physical, like a tumor or a twisted section of the bowel, the surgical route is often necessary. During surgery, doctors will remove the obstruction, repair any damage, and in some cases they might have to remove a section of the bowel. The choice of non-surgical versus surgical treatment isn't a coin toss. It relies heavily on the cause and severity of the obstruction. For instance, obstructions caused by inflammatory bowel disease might respond well to medication, while those caused by cancer or a twist in the bowel, known as volvulus, will likely require surgery. And remember, time is of the essence. The longer a bowel obstruction goes untreated, the higher the risk of serious complications, including infection and tissue death. In the end, the goal is simple: clear the roadblock and get the digestive highway running smoothly again. Whether it's through medication, close monitoring, or surgery, the objective remains the same. It's all about getting you back on the road to health, ensuring a smooth journey through the digestive system. So, what did we learn about detecting and treating bowel obstruction today? We've taken a journey through the unseen obstacles, identifying the importance of conversation in diagnosing bowel obstruction. We've explored how vital clues can be gathered from patient history and symptoms, and how these can lead us to suspect a blockage. We've also seen how a thorough physical examination can further confirm our suspicions, and how it can offer valuable insight into the patient's condition. We then ventured into the realm of imaging, understanding how it can provide a clear picture of what's happening inside the body, helping us to confirm the diagnosis and determine the severity of the obstruction. Finally, we touched upon the various treatment approaches, from conservative management to surgical intervention. We've seen how the choice of treatment depends on the nature and severity of the obstruction, as well as the patient's overall health. Remember, early detection and treatment are key in managing bowel obstruction, so if you ever hit a digestive roadblock, you now know the path to recovery.